We've looked at many different aspects of diabetes here on EASD Live, but one that we haven't looked at so far is the effect on brain and on mental health. And with me I've got Richard Holt from Southampton. Richard, you've done some presentations and posters. Tell me a bit more about the brain, mental health and diabetes.
So I think the link between the brain and diabetes is absolutely fascinating. So we know people who have diabetes are at increased risk of developing a whole range of mental health issues, including things like depression, diabetes, distress, anxiety. But on the other hand, we also know that people who have mental health problems have a marked increased risk of diabetes. And in fact, my research interest started by looking at the links between schizophrenia and the antipsychotics and the development of diabetes. So I think this two-way interrelationship between the brain and diabetes is absolutely fascinating. And it's a really important problem, and I think it's something that's not given enough recognition in diabetes circles, and yet it should be, because we know that people who have mental health problems, particularly things like depression, really affects the way that they are able to manage their diabetes. So if we look at people who have both diabetes and depression, we know that they are less likely to follow a healthy diet, less likely to exercise, less likely to take their medications as prescribed. And so it's perhaps then not surprising that these individuals are also more likely to go on to develop some of the complications of diabetes. And there was a really interesting study that came from the United States a couple of years ago that showed that if you followed people with both diabetes and depression over a long period of time, about 8% of them died every year. So levels of mortality that are worse than many cancers. So I think that from a healthcare professional, we really do need to take account of mental health when we're looking after people with diabetes.
So is it because the brain is affected by a systemic disease, or is it more subtle than that? It's about the brain, it's about the kind of the news and the impact of the diabetes, which is, how do we untangle that?
And again, I think that's a really fascinating question. So the traditional view was you're given a diagnosis of diabetes that's associated with a long-term complications, and then upon that you've then got the burden of the management, so you're told you can't eat your cakes anymore, you've got to stick needles into yourself. And so it's perhaps not surprising that there was then the thought that some people might then go on to develop
So a very
depression.
mechanistic view.
So, and indeed there is quite a lot of evidence to support that psychological model. So if we look at the rates of depression among people with diabetes, which is undiagnosed, it's actually not that different from the general population. And there's something about learning that diagnosis that then increases your risk of developing depression. And I think from a clinical perspective, that's really important. So we need to think how we communicate that diagnosis in a most supportive way in order to try to reduce that psychological burden. But having said that, I think that's far too simplistic just to say that it works in that way. And if we think about glucose, we know that it's a very important metabolite for the brain. The brain functions with glucose. And we know that if glucose levels are very low, that people behave differently. And similarly, if the glucose levels are very high, they behave differently. And there have been some mechanistic studies looking at MRI scans of people with diabetes, actually showing specific changes in the brain in the areas that are important for both cognition but also mood, and those relate to changes in blood glucose. So I think, yes, there is something about that psychological model, something about knowing about the disease, something about the burden, but there's also other things, direct effects of the brain, but also in type 2 diabetes, potentially effects of inflammation in the brain as well, that may also put at-risk people at a higher likelihood of developing depression.
And we've seen one or two presentations here, mainly in the posters, that that effect on behaviour extends to eating behaviours as well.
Yes, absolutely. So if we think about eating disorders, people with diabetes have a higher risk of eating disorders. I guess in some ways that may be because manipulating insulin doses is a way of controlling body weight, and this is something that is seen particularly in younger people, particularly younger women with type 1 diabetes, who actually learn this a way of manipulating their body weight is to adjust their insulin.
And what does this all mean for the average practicing clinician?
Well, I think it means that we need to take an interest in this. And I think that one of the joys about being a diabetes clinician is that we do work in a very multidisciplinary way. So as part of our everyday clinical practice, we think about not only the glucose itself, but we think about how to protect the heart, how to protect the eyes, how to protect the kidneys, how to stop foot ulcers. So we're actually already got our fingers in a number of different clinical pies, but for some reason there seems to be a reluctance to actually delve into some of these mental health and psychological issues. And I think that partly because there is a lack of access to psychological support and psychiatry support across many healthcare systems, but also because of the importance of mental health and mental well-being within diabetes management, that we absolutely have to get in there and help identify people who are struggling with mental health issues. And if we can't support them ourselves, and obviously to make appropriate referrals, just as we do with cardiovascular disease or eye problems or foot problems. But for us to say, oh, that's somebody else's problem, I think is completely the wrong approach. We've actually just got to get in there and just make it part of routine diabetes practice.
Well, thank you very much for that. A really interesting area, and you'll find many different aspects on the brain scattered through the EASD programme. And you can see it all on easd.org.